Well, I think the main issue, Beverly, is that vaccine passports underscore two issues that exist, sort of weren't created by COVID, but existed before. First of all, people's concern about vaccines, that's existed before. Secondly, people's concerns about data and personal data. So all the problems that we're seeing now with the vaccine passports are really manifestations of something that countries haven't invested enough time in tackling with their populations before and coming out with policies on data and vaccinations. But the question of vaccine passports and how they're rolled out really differs country to country. I happen to be here in Geneva and in Switzerland, crossing the border regularly, and we have a vaccine passport, Switzerland, that's also used in France. So the questions that we have for countries going forward on those passports, I think will be resolved country by country.
Yeah. What might be the flow-on effect of this European summer as people return home and have been travelling so extensively as this Delta variant is spreading?
Well, I guess the big question that I have as someone who directed injection safety for years and something we've spoken about before is really the concern that we're not doing a good enough job globally at vaccinating the world safely. Right now, around the world, we're not sending the necessary syringes and the necessary investments and even the vaccine doses to ensure that countries everywhere can have access to safe vaccination. So you could have tens of millions of people infected because of unsafe syringe use in developing countries, and also even as much as 2 million people dying from the infections they get at the end of a dirty syringe. Now, that's not an issue in high-income countries. That's a developing country issue. But we won't be safe in terms of most countries unless all countries have better access to the vaccines.
Increasingly, COVID zero, which has been the approach of Australia and other countries, is not realistic. How does it become possible to live with COVID? Is it only through vaccinations?
Well, you see that countries that depended almost entirely on a COVID zero or a public health measures approach, that's Australia, but it's also places like Thailand, Taiwan, and some of them were forced to do that because they didn't have great access to the vaccine, or countries that doubled down on the vaccine and vaccine access, such as the US and UK. Both groups of countries have done very poorly, actually, and it's quite clear that going forward, a combination of a strong vaccine program and good public health measures are going to be necessary. Now, I personally believe as a public health professional that some method of being able to assess people's vaccination status, which is something we've done for years for children, for everyone entering school, will be a key in that. So call it vaccine passport or some other proof, but we'll have to have both vaccines and public health measures as we move into this time of booster doses, which will create a whole set of new problems and new challenges for us.
Yeah, and when you come and talk about booster doses, of course, that means the wealthier countries are just going to have that access, and it's going to still delay the flow-on effect to the less developed.
It is true. Right now, we haven't done a good enough job globally. Only 9% of the COVAX promised doses have actually been delivered. And meanwhile, 22 countries are already planning booster doses without even regulatory sort of sign-off on that. But my concern also is that even in countries such as Australia, such as the US, and here in Europe, we had massive wastage during the whole rollout of the initial vaccine program, these vials where if you open them, they had to be used. And we need a better way of somehow rolling out this booster plan, expand access for other types of health professionals to be able to vaccinate. And ideally, it would be much better if we had a single-dose presentation for those vaccines in terms of being able to save and safely vaccinate people around the world.
Yeah. We're seeing countries like the US moving towards vaccine mandates because there's sort of hesitancy, and sometimes it's political at the end of the day too, particularly in the US. Should it be a carrot rather than a stick approach?
I think it's going to really depend country by country. For instance, if you just take France President Macron sort of put in the vaccine passport approach and said, if you want to, we won't have a mandate, but if you want to take part in these particular activities, you will need a vaccine, quote unquote, passport. The next day, you had the biggest one-day sign-up for vaccines, which of course is going to be the way that we move out of this pandemic. So clearly just leaving it to people to sort of decide whether or not they'd like to get the vaccine is not the way. Also, coming down very strong and mandating won't work with the legal systems and sort of culture of many countries. So it'll be a country-by-country approach that I think begs the opportunity for interviews like this and learning from other countries as a chance for people to make good policy choices.
And just finally, you know, when Australia is now talking about opening up and trying to live with the virus at about 70 to 80% vaccination rate, what is your advice?
Well, it's clear we're learning more and more every day. So everything I say today, I hope you'll invite me back and I can refute my own statements. But the idea that we were going to vaccinate our way out of this has been totally put aside by Delta. It's quite clear, WHO has said it, my colleagues there, that we'll be living with COVID for a long time. What we won't be living with, if we succeed in vaccinations and in managing through public health measures, are people getting severe cases, going to the hospital, and dying of COVID. We will definitely have cases of COVID for multiple years now, much as we do the flu and other coronaviruses. But right now, the main point is to vaccinate as many as possible, get that vaccine to the developing world so we don't develop the next more deadly version of Delta, and ensure that public health measures are in place.
Ed, great to talk. Thank you very much.
My pleasure, Beverly. Thanks for having me.